So there's three different forms of surgical abortion. The most common surgical abortion is the first trimester abortion, where maybe it's performed up to about 13 weeks along in the pregnancy. The women will be placed into the exam table, their legs will be up in the air, and a speculum will be placed in the vagina of the woman to see and give access to the cervix. A grasper is then taken up, it's called a single tooth tenaculum. It grasps the anterior area of the cervix, but the cervix job is to keep a pregnancy inside. So in order to perform an abortion, that cervix needs to be opened to allow the instruments to be placed up into the womb. So dilators are used, one after the other. Small size, then a little bit larger size, and then a middle size are used and placed into the cervix to force the cervix to open up. Once the cervix is opened up to about 10 or 12 millimeters in diameter, then a small tube called a suction curette can be placed up inside of the uterus. The suction curette is hooked up to a tube which goes over to a suction machine, which can produce enough suction that if we were attached that exact same machine, that exact same suction curette to a empty paint thinner can, a steel can, we can actually see that can collapse from that pressure. While that same suction curette, a hollow plastic tube, is then placed through the cervix and then up to where the baby is. And this is a baby that is moving around on the inside, a baby that has fingers and toes, is jumping and sliding on the inside of the womb, a baby with a beating heart, a heart that's beating about 150 beats per minute. Once that suction curette is brought up next to the baby, the suction machine is turned on, and the baby, the placenta, and all of the fluid are brought up through that suction curette and taken to the tube into the collection system of the suction machine. The second most common form of abortion performed surgically in the United States is for a second trimester abortion. A second trimester abortion is performed after 14 weeks, but maybe up to about 23 weeks, where the baby has developed to the point where it's too large to just be brought through a suction tubing, but the baby is too small to just induce the labor because it's usually not effective. A second trimester abortion, sometimes this has to be performed over hours and sometimes over days because you need to open up that cervix large enough to bring the products in this of the baby, the fingers, the toes, the arms, the femur, the skull, out. So once the cervix has been dilated, whether mechanically with dilators, and sometimes they'll use little devices called laminaria. Laminaria are just little sticks with a string on them, which are placed into the cervix, and then some saline and some gauze is placed into the vagina. Laminaria, sometimes they're made out of artificial substances. Sometimes they're actually made out of dried seaweed. The laminaria over hours or even the next day will swell and will dilate and will open up that cervix. Once the cervix is dilated enough, then instruments are placed up into the uterus, and they can't just grab the entire baby. Sadly, they will, with ultrasound guidance usually, they'll grab what they can. The baby's moving around on the inside, and the baby is alive. They might grab a leg, they might grab an arm, they might grab a hand, and piece by piece, sadly, they will bring the parts of that baby out until they have removed the baby, and they then will go up with a suction machine and with a sharp curette and will scrape out the lining of the uterus where the placenta was attached. The least common form of abortion, but emotionally the most traumatic, is a partial birth abortion, where the babies are delivered in the third trimester. These are babies that could easily survive in any nursery here in the United States, and the majority of third trimester abortions are not performed because the mother's life is threatened. They're not performed because there's something very abnormal with the baby. The majority of third trimester abortions are performed still just electively. The mom doesn't want this baby. The most common way to perform a third trimester abortion is under ultrasound guidance to first grab the feet. Why the feet? Because if the baby is delivered head first, for some crazy reason, if the baby takes a breath, it's considered a life. Well, The baby is on the inside. The baby is moving around. This is my patient up on the inside. Clearly, the baby is a human life on the inside. And it's not a matter of just giving this baby a breath. It's a matter of this baby was created in the image of God at the moment of conception. But they will actually take instruments, guide them with ultrasound, and they will try to grab the foot of the baby. The foot of the baby is then brought from the womb, from the uterus, and brought down into the vagina. Once the one foot and the one leg are on the outside, then they can reach up, grab the other foot and the other leg, bring that down. Then gradual traction will then bring the abdomen of the baby out, followed by the chest of the baby, followed by rotating the baby and bringing out the right hand, rotating the baby again and bringing out the left hand. And they will rotate the baby so the baby is looking down towards the floor. The only thing that is on the inside of the uterus, the womb itself, is just the placenta and the umbilical cord. The entire baby is either completely on the outside of the mom, but the head is only there on the inside of the vagina. But the baby still cannot take a breath because it can't get access to the air. So before the baby can deliver and get that first breath, they will actually take a pair of scissors, a pair of Metzenbaum scissors. If you remember from anatomy class, at the base of our skulls is an opening where the cord coming out of the spinal cord comes down from the brain and then into our backs. Well, they will take that pair of scissors, they will introduce it up through the foramen magnum, up into the skull of the baby where the brain is. If that doesn't take the life of the baby, they will then reach over to the suction machine, and using that same suction curette, which is used in the first trimester, they will take that suction curette and they will pass it right through the foramen magnum of the baby, up where the brain is. They will then turn on that suction machine, and that will absolutely kill the baby. Once they know the baby is dead, they can then deliver the rest of that baby. But the majority of that baby was already on the outside. All of that baby was outside of the womb. It is horrible. It is barbaric. It is clearly murder, whether it's the first trimester, second trimester, third trimester, or even the abortion pill. All of these are tools of evil that are taking the life of an innocent baby, one of my patients, a baby that shows no threat to the life of the mother, and it is taking that unique life in the womb.